Thank you. Welcome to the July 14th Licensing Committee meeting. I am Debbie Veal, the chairperson of this committee. Before we start our meeting, I'd like to advise all individuals observing or participating in the meeting that this meeting is being conducted consistent with the provisions of Governor Gavin Newsom's Executive Order N-0821. Participants watching the webcast will only be able to observe the meeting. Anyone interested in participating in the meeting must join the WebEx meeting. Information and instructions are posted on our website. I will announce when we are accepting public comment on the various issues, and the meeting moderator will open the lines as appropriate. I've advised the moderator to allot 2 minutes to each individual providing comment. This approach is necessary to facilitate the meeting and ensure the committee has the opportunity to complete its necessary business. I appreciate everyone's understanding and patience as we navigate this meeting format for our committee meeting today. I would like to ask the moderator to provide general instructions on how to participate at appropriate times throughout the meeting. So I know you kind of did a little summary of the new bells and whistles, but if you could just go over the how to participate maybe one more time in case people join late, I would appreciate it.
My pleasure. So as we enter each phase of public comment and the committee chair calls for public comment, I will open the question and answer feature in WebEx. When I do that, I will display the following instructional slide. If you'd like to make a comment during the public comment session, you will be locating a Q&A icon on your screen that looks like a question mark inside of a square. That will open a pop-up window with a text box, and in that text box, you can simply type comment and submit that to all panelists. We will be taking comments in the order that they are received. When it comes your time for comment, I will call out to you based on the name that is displayed for you on the attendee list. I will let you know that I am unmuting your microphone. When I do that, you will receive a pop-up on your end that allows you to unmute yourself. You'll simply click the unmute me button when that pops up, and that will open your microphone. Once you begin speaking, I will begin the timer for a 2-minute public comment, and we'll be providing a 10-second reminder when your time is about to expire. When your time is expired, I will mute your microphone and move on to the next public commenter.
Thank you, moderator. And I just want to emphasize to make sure you just type in the word comment when you want to speak and not put in your question, because we will ask you to verbally enunciate your question. Okay, I'd like to now take a roll call and establish a quorum. Members, as I call your name, please remember to open your line, unmute yourself, and announce if you're present or not. Sung Oh.
Here.
Thank you, Sung. Cheryl Butler.
Here.
Jason Weiss. Thank you. And I believe Jig Patel is not present. I'm going to call just to make sure. Okay. Nonetheless, we have established a quorum, and the committee will now entertain any public comments for items not on the agenda. To facilitate this portion of the meeting, as previously announced, the moderator will open the phone lines to provide an opportunity for the public to make comment. You are not required to identify yourself, but may do so. As we open the lines, I'd like to remind everyone that the committee cannot take action on these items and really can't even comment on them, except to decide whether to place it as an item on a future agenda. So moderator, would you please open the line for public comment at this point?
This is the moderator, and we have opened the Q&A panel. Again, if you'd like to make a comment, please click on that Q&A icon on your screen, type comment into the text field, and submit that to all panelists.
Moderator, it looks like we're not getting any takers today.
I am not seeing any. I was giving it just a little extra time because I'm not sure if that Q&A icon has moved in this new version. But
Okay,
again, I'm not seeing any. So if you're fine with it, I will go ahead and close it.
let's go ahead and close it.
Okay, it is closed.
Thank you. We'll move on to our next agenda item. And that is the approval of the April 2021 Licensing Committee meeting minutes. Hopefully the members have all had a chance to review the minutes. Are there any comments on the minutes? Any changes or items that you think are wrong?
Accept, adopt, Debbie. This is Song.
Thank you, Song. Do I have a second?
Debbie, yes, I will second.
Thank you, Cheryl.
You're welcome.
So now that we have a motion to approve the minutes, moderator, and we have a second. Moderator, can we please open the line to see if the public have any comments?
This is the moderator. We've again opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Not seeing any requests. Would you like me to close the panel?
Yes, please.
It is closed.
Thank you. With a motion and second and public comment received, I will now take a roll call. Once again, members, please remember to open your mic as I call your name and vote either yes or no to accept the motion to approve the April 2021 minutes as presented. Song,
Yes.
Cheryl,
Yes.
Jason,
Yes.
and I vote yes. So unanimous, we will approve the April 2021 Licensing Committee minutes. Okay, I'm now going to move on to agenda item. Wow, it's already agenda item 4. Discussion and consideration of pharmacy technician duties and possible changes. Existing law establishes the function of the pharmacy technician, and the existing law or relevant law is available in the committee report. So I'm not going to go through each section. As part of as indicated in the meeting material in 2017, our committee convened a pharmacy technician summit. And as part of that summit, the application and renewal requirements, as well as the authorized duties of the pharmacy technicians were considered. Subsequent to that discussion, the committee focused on the development of an advanced pharmacy technician proposal, which will be discussed later in our meeting today. More recently, in October 2020, the board voted and approved a policy statement that stated the board's belief that influenza and COVID-19 vaccine administration may be safely performed by specially trained pharmacy technicians under specified conditions. This policy statement included that the board supports efforts to secure both a temporary authority through a waiver, as well as a permanent solution through statutory or regulatory changes. The board has not yet pursued any permanent solution. At the last summit was convened on pharmacy technicians once again in 2017. So the first thing I would like to ask the committee members is if you'd be interested in scheduling another summit at some point later this year, perhaps before the next board meeting, but we can kind of look at schedules and well, it won't be the next board meeting because that's in July, but perhaps before the following board meeting. This may provide an opportunity for us to really kind of understand the situation and do a more comprehensive review and allow the committee to take a deeper dive into the various practice settings. I know one of the things that was discussed previously and was also mentioned in a letter that we received was that we did want to, see if the survey, the workplace survey provided any information back. I'm not sure it's going to speak to pharmacy technicians, but perhaps it will. So I think that's also a reason we may want to lean towards a summit. So I'm going to roll call the members of the committee and ask for your thoughts. I'm going to start with Song.
Hi, Debbie. Yeah, I support the summit, and I do believe it would be important for us to hopefully there's some data that we can have based on what we've been doing. And I also I don't want to jump ahead, but I feel like agenda item number 5 and 6 is kind of related to it as well. So I'm hoping that we can have a broader summit, and hopefully we can also actually, discuss this as tied to workforce survey, because you know what, I was trying to research what other states were doing, and I noticed that state of Illinois, when they were studying about their workforce survey, they did is kind of tie into the technician duties and responsibilities and anything related to it. So I'm hoping that we can have a broader summit and maybe tie this issue into a workforce survey in the future agenda item. And hopefully we can look at this kind of after the waivers are really done. So it's not, because there's a lot of confusing change of practices that have happened because of COVID. And so hopefully, there can be a more clearer discussion by having a summit or whatever we want to call it, a subcommittee or so that would be I would support that.
And let me just ask you one thing, Song. We have a workforce survey that is out there. That's what you're referring to. You're not referring to something different, correct?
Right, yeah, it's the survey that we just conducted.
Right. Okay.
Once the results are analyzed and we're able to discuss it, is when I think we can tie this issue into that item, in my opinion.
Okay. Cheryl Butler.
Yes. Yes. Yes, Debbie. I agree with the idea of a summit, because there is a lot of information out there now with with COVID, as a result of the COVID crisis, and I really think that we should actually have a summit that would also um, be broader, in the sense that we can also look at tech duties. Thank you.
Okay, thank you. Jason. Jason, do you have any comments?
Can you hear me now?
Moderator?
Sorry.
Yeah,
Sorry
we
about
can.
that.
No problem.
I was just saying I too would support some kind of convening. I think more feedback and information from all of the parties would be helpful to me, and I think would get us to where we want to go.
Okay.
Thank you.
Thank you, Jason. Yeah, I feel like the last summit, was quite a while ago. And I know even after that summit, we heard at a board meeting that folks felt like additional information and additional meetings were necessary before some decisions were made about this topic. So I do think it's prudent. However, I do also want to hear from the public because I think that perhaps, I'd like feedback on the summit idea. But also what I'd like to do is, see if there's any any other thoughts from the public as far as, what we need to address in that summit. So moderator, at this point, I would like to open the lines for public comment, both on potential summit as well as really any duties that they think we should, be considering, we should have on the plate. It'll kind of help us, I think, formalize how we do the summit.
I've again opened the Q&A panel. If you'd like to make a comment, please click on the Q&A icon on your screen. Type "I would like to make a comment" into the text field and submit that to all panelists. We do have a comment request from Siba. Siba, I'm requesting to unmute your line.
Morning.
Good morning. Thank you. You will have 2 minutes.
Absolutely. Thank you, Debbie. And I'm so glad to be able to attend this meeting. And I really thank you for your time and for the discussion in this matter. And yes, I do agree with the board members that a summit is a great idea, especially that 2017 was a while back and lots of changes have been down in the pipeline. Being a pharmacist, I've actually been working quite a bit during COVID and experiencing and benefiting from some of the changes that you've approved. I'm very, very happy to hear and be part if you need my help as well during that summit. Debbie is quite, not Debbie, both and Cheryl know me pretty well, but I am the director at Cerritos College for the pharmacy technician program as well. So I wear several hats. And so if you do need some more help or a little bit more information on the some of the educational portions and pieces as well, and I'll gladly help out. And that's all. Thanks.
Thank you, Nasiba. Always appreciate your comments.
Our next comment comes from Keith Yoshizuka. Keith, I've sent the request to unmute your line. I see you're open. Can you retest your microphone?
Health system pharmacists. We applaud the board's initiative to commence a summit to discuss these issues, and we look forward to providing our input.
Thank you, Keith.
Our next comment comes from Lawrence, and I'll just remind everyone, give your microphone just a second to make the connection before you start speaking. Lawrence, I've sent the request to unmute your mic.
Good morning, Lawrence Louie, President of United Pharmacists of Southern California. We represent almost 1,600 pharmacists in the Southern California area, consisting of all service lines from ambulatory care to inpatient to outpatient or community pharmacy. Yeah, we welcome participation in such a summit, and we look forward to providing comments. We do have concerns about the expansion of pharmacy technician duties as granted during the emergency discussion during the height of COVID to allow technicians to administer COVID vaccines and even influenza. My concern is that we don't really have that emergency today, and the vaccine flow is low and steady. So primarily from our point of view, we don't think we should be taking advantage of emergency waivers to make them permanent.
Thank you, Lawrence.
Our next comment comes from Mark Johnston. Mark, I've sent the request to unmute your mic.
Good morning. This is Mark Johnston from CVS Health. CVS certainly would enjoy a technician summit. And personally, gosh, I hope it's going to be in person. I look forward to the day when I can jump on a plane and come down and see everybody in person. I understand that might be out of your hands at this point, but again, I look forward to that day, which is hopefully sooner than later. The only other thing I wanted to say at this point is there was a reference to what happened in Illinois, and Illinois did see tech expanded duties as a solution to their perceived workforce issues. They did pass law that said that a pharmacy technician may be delegated to perform any task within the practice of pharmacy is specifically trained for that task, except for patient counseling, DUR, and clinical conflict resolution. They went on to put some guidelines around transferring prescriptions, taking verbal prescriptions, immunizing. But I agree with what the committee member said, that these two issues could be linked, and we can look to Illinois for some historical guidance. Thank you very much.
Thank you, Mark, and thanks for that information around the Illinois board.
Our next comment comes from Lindsay Gullahorn. Lindsay, I've sent the request to unmute your mic.
Morning, Chairwoman Veal and committee members. This is Lindsay Gullahorn with the California Retailers Association and the National Association of Chain Drugstores. And we absolutely do support the idea of a summit. I think it's a good idea, and we're happy to be helpful or be a resource however we can. So thank you, Chairwoman Veal, for bringing that forward, and we are looking forward to it.
Thank you, Lindsay, for your comments.
Our next comment comes from Stephen Gray. Steve, I've sent the request to unmute your mic.
Thank you very much. Good morning. Thank you very much for the opportunity to comment. I also support the summit and want to emphasize a couple of things. I do believe that the summit should be scheduled when we can meet in person. This is an extremely important subject matter, covering most of the agenda items on today's agenda. And it's important that we have it in a forum and in a style where we can have a conversation. And if it is done virtually, and if the comments from the public and other interested participants are limited to 2 minutes, that doesn't really accomplish what I believe the chairperson wants, which is a really thorough, deep discussion, back and forth with the pros and cons of each idea. So I would hope that we could schedule this, even if it had to be later than what the chair recommended, to be at a time when it's in person. Secondly, I don't think that we can, I think part of the problem we've had is that the definition of technician is different all across the country. And probably California is an outlier in the sense that when we talk about technicians and under the current California law, it is very limited, where in many states, the term pharmacy technician is synonymous with anybody that's in the pharmacy helping out the pharmacist, anybody other than a pharmacist in effect. So there really needs to be a good discussion and clarification as to what we mean by a pharmacy technician versus other personnel in a pharmacy or other personnel helping a pharmacist in any environment. Thank you.
Thanks, Steve, for your comments. And I do agree with you and one of the other commenters that it would be great if we could do this in person. I don't know, Ann, do we have any idea of when the governor's order is going to be lifted?
Debbie, hi, this is Eileen. No, we don't. Currently, the governor's order extends the exemptions for the teleconference for Bagley Keene through 9:30. But we don't know if the governor will extend it beyond that time period. It may, obviously depend on the status of the Delta variant and other factors beyond their control, but we don't have any idea at this point.
Eileen, thank you very much. I'm sympathetic to. I agree with you, Steve. Your comment that it would be. It seems like it would be easier, more productive if we can do it in person, but I'm not sure how long we want to put it off. So we'll take that into consideration as we plan for the summit. Moderator, looks like we had another person.
Kathleen, I've unmuted your microphone or requested to unmute it.
Hello, can you hear me?
We can. Go ahead.
Oh, thank you. I am a pharmacist in the community outpatient setting. I've worked in independent, Walgreens, and CVS. And I just wanted to say that I think an in-person summit to further discuss it would be very important. This impacts my profession and the livelihood. I'm so sorry, frog in my throat. So the long-term effects of these types of decisions, I think, should be made in person and a detailed summit with public attendance. Thank you.
Thank you, Kathleen, for your attendance and your comments.
Our next comment comes from Danny Martinez. Danny, I've sent the request to unmute your mic.
Members of my name is Danny Martinez. I'm with the California Pharmacists Association. We too are in support of a technician summit. I do have a question because I guess, and I apologize if I missed this earlier in the meeting. It seems like this summit is going to be discussing items that either resemble or are exactly the same as to what the items are later in this agenda. Is this summit intended to do that, and if so, is discussion on those topics on the agenda today necessary if we're going to be discussing these at the summit, or is the intent to discuss them both here and at the summit?
Hi, Danny. The intent is for the summit specifically to be around the pharmacy technician duties and changes. I agree after hearing what others have said that perhaps we will end up with discussions around the agenda item 5 and 6 at the summit. I think we still are interested in hearing, people's perspective, stakeholders' perspective on all 3 agenda items to kind of help us prepare for the summit and understand, perhaps where we're going to be going. But, if you're asking, are we just going to kind of blow through the next couple of agenda items? I mean, they are agendized and we will be discussing them because we have agendized them for the public and we need to give the public an opportunity to speak to these items today. And then how we decide to move forward. This is a very, very strong committee, and I'm sure that they will provide very sage information.
Okay, I appreciate the clarification. Okay, thank you very much.
You're welcome.
Our next comment comes from Jazzy. Jazzy, I've sent the request to unmute your microphone. She cannot unmute. Jazzy, are you receiving the request at your end to unmute your microphone? You can answer that in the There we go. We can hear you
Getting
now.
used to the new WebEx function. This is Jazzy Graywall with the United Food and Commercial Workers Western States Council. We represent pharmacists and pharmacy technicians at community pharmacies throughout California. I would just echo the comments of those made by previous commenters. We would support a pharmacy technician summit. Would also prefer it to be in person to be able to have a dialogue. Just wanted to also share that maybe it makes sense to have a listening tour so that more pharmacy technicians from all over the state are able to participate. We are a rather large state, and so having it housed in one location might make it difficult for folks, whether they're from the far south or from the far north of our state, to be able to attend. And then also figuring out a date and time where pharmacy technicians will be able to make the summit. I know attendance is often difficult for our members as they are constantly working, particularly throughout the pandemic, they're working overtime. So I just wanted to make sure that in order to ensure the most amount of attendance and the most amount of perspectives, just to make those points. Thank you.
Jazzy, thanks for your comments. And this is Debbie Veal, and I appreciate the letter that was also provided. Can I just ask you one question? I'm assuming you're familiar with the letter that was sent by UFCW.
Yes, I was.
Can you just I was trying to understand one of the things that I think one of the points that UFCW is trying to make is that education would not be a requirement to be, that's really advanced practice. So maybe I wait until we get to that.
Yes, happy to discuss that when we're at that agenda item.
Okay, thank you.
Of course.
And not seeing any additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Debbie, I'm sorry. This is Song. I have just one comment.
Sure.
So I know that what I'm going to request probably is related to agenda item number 5 and 6 as well as 4. I just feel like, as I said, I think they all go together. If I may request all the stakeholders involved, I would like to get as much studies that were out there as possible. If anybody has any information or any studies relating to technician duties or ratio or advanced practice technicians or tech programs, if I would request that sent to be either to the board president or to the chair or to our executive officer, I would greatly appreciate it.
Agreed. I think all three of these topics warrant, the more knowledge, the better. So I think we're moving towards a summit. Anne, is this something, or Eileen, would it be best for us to actually make a motion in regards to the summit on this agenda item? Since it may incorporate the other agenda items, is it better if we wait until we complete agenda item 5 and 6? Or what is your advice, Eileen?
Hi, this is Eileen. I think that's kind of up to the board's determination. If you make a motion now and then you keep amending it, but I think I might go to, item 5 maybe, and then open that for discussion for the board. But I leave that up to the board if you don't mind changing the motion if it comes for each one. But I think it makes more sense, as you had said, to give the opportunity for public comment on each and individual item because they were all agendized. If the board wants to wait to make a motion after hearing all of those, I think that would be appropriate as well.
Okay, board members, I think that is going to be my recommendation, is that we make a recommendation on how we want to proceed after we get through agenda item 4, 5, and 6, because I think we're leaning towards a summit on all 3 items that will encompass all 3 items. Or maybe after we talk through them, we will only want 2 items. I don't know, but my feeling is let's at the end of agenda item 6, at that point we make a determination on exactly what we cover in the summit.
Sounds good to me, Debbie.
Cheryl, are you in agreement?
Yes.
And Jason, is that okay with you? Okay, perfect. Then I'm going to move on to agenda item 5, which is discussion and consideration of pharmacist to pharmacy technician ratio in community and sterile pharmacy compounding settings. Members, as you may recall, during the April board meeting, we had a public comment, and the members agreed to about a discussion on the ratio of pharmacists to pharmacy technicians into the community setting and compounding pharmacy settings. So in response to that, request by the public, this item was agendized today. And specifically, the commenter suggested a ratio of 1 pharmacist to 2 technicians would be appropriate. So included in the meeting materials is a summary of how other jurisdictions have approached this issue. As a committee, it is our opportunity to review the current requirements in California and determine what, if any, changes should be recommended to the board. And, you know, understanding that the ratio discussion is complicated and it's been something that's kind of bounced around quite a bit, I think, in the last couple of years. But ultimately, as required by statute in our decision making, we need to, you know, make sure that we're focused on the protection of the public as our highest priority. So there's, at this point, I don't think I really want to go through how other states have addressed this, other than to say that there have been some movement recently in other states to adjust ratios, and for the most part, it's always an increase. I also want to highlight in 2017, it appeared that there was a general consensus during those summits that a 1 pharmacist to 2 technician ratio would probably be appropriate. However, definitely have been some changes in pharmacy practice since that time, so it's reasonable that we need to discuss it again. I'd appreciate any comments from the members on this issue, and also as part of your comments, how you think changing the ratio could favorably impact the Californians and further the board's consumer protection mandate. So just to kind of give an overview, you know, once again, this is, I'm assuming that everyone's going to probably say, let's put this on the agenda for our summit. But, you know, I don't know if any of the board members, and I'll do a roll call, I'll go through each one of you to see if you have any comments kind of at this point about ratio and any of the comments I've made, kind of trying to pull together this request from the public to address it, and just kind of a little bit of you know, thoughts. With that said, Song, I'll start with you.
Thank you, Debbie. I don't want to sound like a broken record, so I'm going to not talk about the summit, but actually on this issue, one thing I want to request, I don't know if it needs a motion or not, but I think we need to discuss the sterile compounding pharmacy settings in a totally different setup, agenda item compared to community pharmacy or other pharmacy technician ratio. So I just feel like the sterile compounding pharmacy ratio should be discussed its alone, maybe in an enforcement committee or some other fashion. So I just think it'll cause a lot of confusion if we include this into the technician summit in some fashion. So I'm hoping that whatever the council recommends, that how we separate it, if you are agreeable or and the board members are agreeable, I think we need to separate this issue out.
I guess I still think that this is licensing, and I think that we might have others say the same thing about other parts of our profession, that maybe the ratio is different. I think the ratio actually might be different even in the hospitals today. So I don't think that we need to, send it to enforcement. I think it needs to stay in licensing. But I think that maybe when we look at ratio, we, that's one of the questions we ask ourselves and ask the folks. And then, it's going to come down to if sterile compounding has a different ratio. Once again, how does that align with, protection of the consumer? Why would it, and I'm assuming you're saying that there might be a higher ratio for sterile compounding, and why would that be versus the community? So I think we'd have to answer that question, and I think the forum or the summit would be a good place to have that discussion.
Okay, I think it's just would be better though we separate the agenda though if we talk about it.
Okay, I'm not exactly sure. I'm not sure I understand your point, but okay. Cheryl?
Yes, I definitely think that we should address the ratio in the summit. I do see this lean toward the 2-to-1. As far as as far as the sterile compounding is concerned, I don't know. I guess with the compounding committee, I don't know. Maybe there's more knowledge about what their needs are, and so much as what they feel the ratio should be, because of my 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 knowledge being more retail and community pharmacy. I've worked IV pharmacy, but it's not a whole lot I do know about the whole sterile compounding setting to really have a knowledgeable input on the ratio there. So that's my comment.
I would think, Cheryl, that don't you think we'll have people from sterile compounding attend our summit, and that they could provide us the input? I mean, I don't.
Okay, I'm okay with that.
Okay. Jason?
Hi, Debbie. Yeah, I think I would just really appreciate more data. What studies do we have? Comparisons of states in an apples to apples. I know that may not be exactly possible, but what other states are doing, I think, would be very helpful to have that information for me. Thank you.
Okay, and I think Song has already made a very good appeal to the stakeholders that are currently on to please send us data. I think that there was also a good comment made earlier that we have to not only look at the data, but also look at the definitions of technician state to state. But I agree. More information would be preferable. Okay, with I think us kind of moving towards making this part of our summit. I think we're probably not going to have any kind of a motion at this point. We're going to have a motion after agenda item 6. So, moderator, why don't we open up the phone line so that we can hear from the public?
The Q&A panel, If you'd like to make a comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Our first comment comes from Jazzy. Jazzy, I've sent the request to unmute your mic.
Good afternoon. Good morning, Chair and board members. Jazzy Graywell with the UFCW Western States Council. I would like to also urge the board for the summit to also discuss a staffing floor. We often talk about ratios as a staffing ceiling, the maximum that staff that a pharmacy can have at one given point, but we don't often talk about a staffing floor. So we can continue to raise the ceiling, but our pharmacists actually getting the appropriate staffing help that they need to be able to perform their day-to-day duties. And so I would really urge this board to also at that summit discuss what does a staffing floor look like and what is the need for pharmacists on a day-to-day basis to be able to have the appropriate staff to carry out their license duties. And I know that there are currently waivers in place. And so how do we continue to support pharmacists as their duties are continuing to evolve and to expand? And so really just urge this board to also talk about a staffing floor, not just a staffing ceiling. Thank you.
Thank you for that comment. I had never thought about that.
Our next request for comment comes from Mark Johnston. Mark, request for unmute has been sent.
Mark Johnson, CVS Health. I just wanted to respond to the request for literature. I'd be glad to send in numerous white paper studies on tech expanded duties and the relation to pharmacist duties. I also would be glad to send in some, I'll say, more accurate information than what was provided in the board's agenda packet. You know, I was on NABP's executive committee for 6 years. I know firsthand the limitations of using the survey through NABP law. It is sluggish at best in catching recent changes and sometimes past changes. So I do have much better maps and materials, and I will also send those in. Thank you very much.
Thank you, Mark.
Our next comment comes from Lindsay Golohorn. Lindsay, I've opened your mic for unmuting.
Thank you. Thank you. Hi again, Lindsay Golohorn with CRA and NACDS. And we thank the committee for being willing to discuss this issue, potential changes to the pharmacy technician ratio in California, and also for the opportunity to provide comments. And we strongly support adding this to the agenda for the future summit and look forward to being a part of that conversation. I won't go into a lot of detail, but just to say that CRA and NACDS do support expanding the ratio, and we think it'll have a lot of benefits, most notably expanding access to pharmacy services for patients and making pharmacy workflow more efficient by adding to and decompressing the pharmacy team. As you all know, the existing ratio hasn't been changed, I think, in 17 years in California, and it's the most restrictive in the nation. At least 23 other states don't have one, and it's worth noting that NABP supports the complete elimination of the ratio. We appreciate the current DCA waiver that allows an additional technician to be supervised by a pharmacist for vaccination purposes, and this has been incredibly helpful and necessary in combating COVID, but we do believe that the existing ratio should be permanently expanded to allow pharmacies in California to maximize the use of technicians, which will provide more care to patients, continue to get everyone vaccinated, and provide other patient services. One last thing, in states where ratios have been eliminated, there hasn't been any evidence of patient safety issues. So I think modifying the ratio here will have the effect of improving pharmacy workflow. It'll allow pharmacists to spend more time on clinical patient care, reduce pressure on the overall pharmacy team,
and again, increase access to services for patients. So again, we hope this issue can be discussed at the Technician Summit and look forward to that conversation. Thanks.
And Lindsay, did you say, do you have some information that you can share with us? Did you
Yes,
say
we have a lot of information. We're happy to package all of that together and send it to you.
Okay, thank you very much.
Of course.
Our next comment comes from Nasiba. Nasiba, the request to unmute your mic has been sent.
Support the comment made earlier regarding minimum staffing, or as presented as floor. Actually, I wanted to bring this to the board's attention. Community pharmacies at the moment. As a matter of fact, just last weekend, I had to work by myself, which was unacceptable, with only a cashier, which is extremely, in my opinion, unsafe. Had to type prescriptions, check them myself, fill them, and check them again for accuracy. That's a whole day. That's a whole 8 hours of doing this on your own. That is absolutely unacceptable. So, so definitely support discussion over, as was mentioned, the floor with minimum staffing. Thank you.
Thank you, Nasiba.
Our next comment comes from Lawrence. Lawrence, you may unmute your mic.
Once again, Lawrence Louis from United Pharmacists of Southern California. Also, I've been a pharmacist for 30 years. I work in the outpatient setting. I want to agree with Committee Member O that the technician ratio should be separated out from the summit. In addition, technician ratio for home infusion pharmacies, but the whole idea of technician ratios should be separated from the summit as well. There was mentioned previously that eliminating technician ratios or expanding technician ratios would make it easier for pharmacists. I have a contrary viewpoint on that. I feel that changing the technician ratio would make it even more difficult for pharmacists to do the work. It would essentially add more chaos to the pharmacy. And I refer to some 2 or 3 scathing articles in the New York Times last year. One of them was entitled "How Chaos at Chain Pharmacies Putting Patients at Risk," and CVS fined for prescription errors and poor staffing at pharmacies. So as you know, pharmacies are reimbursed per prescription. And as we are adding more technicians into the mix, pharmacists have to supervise them, and not only supervise their work, but check their work. As we're putting more people into the pharmacies, it adds more chaos. I cite that article where in North Carolina, where they do have a 1-to-3 ratio, there is this one pharmacist who had to fill 552 prescriptions in one shift. In Oklahoma, where they have a 1-to-2 ratio, a pharmacist had to check 194 prescriptions in a 6-hour shift, or roughly about 2 prescriptions per minute. So I fail to see how this increases patient safety. Contrarily, it puts patient safety at risk. So there was also a comment about increasing access. We have plenty of pharmacist providers out there. This is basically a matter of costs. It's less expensive for the chains to hire a pharmacy technician than a pharmacist.
My apologies, Lawrence. The time has expired. Our next comment comes from Stephen Gray. Stephen, I've sent the request.
Thank you very much. My comments are a little bit different from what was just expressed. The concept of ratios and the tasks that pharmacy technicians do are absolutely linked together. If you add a task that can only be done by a pharmacy technician, a licensed pharmacy technician, that is currently done by unlicensed personnel in California, then that changes the ratio requirements, and you can actually get into a negative. You can make matters worse by not addressing both the task and the ratios at the same time. My next, and I do believe that there are problems with linking the ratios to the license category versus what is performed at that pharmacy. And I think that's perhaps where Sung Oh is going when he talked about home infusion pharmacies that have a RPH, or excuse me, a PHY license designation being linked to the same as community pharmacies that don't do sterile compounding. The other thing, I think that the board needs some advice from council. I think there's confusion among the board members that if you list for a particular license category, such as an advanced practice pharmacist, whether listing a task that can be done by them prohibits that same task being done by a currently licensed pharmacy technician or unlicensed personnel. I think that the California law precedent is that if you list a task for one category, then that prohibits categories in a lesser authority range from doing that same task. Certainly it wouldn't prohibit the pharmacist, which is a higher authority range, from doing that task. So I think that it needs to be that advice and discussion also, so that we don't get confused about what task listing per license category really implies under California law. Thank you very much.
Thanks, Steve.
Our next comment comes from Kathleen V. Kathleen, I've sent the request to unmute your microphone.
Hello, yes, this is Kathleen. I'm, as I stated earlier, a community pharmacist in an outpatient setting, and I've worked at independent pharmacy, Walgreens, and for CVS. And I agree with Lawrence's comment earlier, 100%. The adding more technicians to supervise and increasing the ratio will just contribute basically to more chaos in the pharmacy. There's so many, I don't know if the board realizes, besides the technicians, there's all the cashiers and assistants, inventory control clerks, everybody who comes into the pharmacy, delivery or not, is all under my license. And to prevent distractions and ensure patient safety, the less that I have to oversee, especially in the technician ratio where they're just piling more and more and more, that's just, I think it's just a better situation for patients.
Thank you, Kathleen, for your comments.
Our next comment comes from Michael Mattis. Michael, I've sent the request to unmute your microphone.
You can hear me okay? Thank you. Yeah.
We can hear you.
Thank you. Michael Mattis. I'm a PharmD graduate from University of the Pacific in Stockton, California. And I'm proud to say I recently received a certificate from CPHA Board of Pharmacy for 40 years of service to this fabulous profession, which I want to preserve for new pharmacy school graduates and the California consumer. When I go to work, I'm responsible for everything and everyone in that pharmacy. Interpretation of prescriptions, confirming drugs, doses, renal function, checking each controlled medication in the DOJ website, money, solving complaints, problems, insurance issues. The issues of 4, 5, and 6 are interrelated. And actually, an increase in the scope of practice would affect other professions, such as nurses as well. If the tech ratio increases, it will take away time from pharmacists performing fundamental duties, patient care. We have no time to supervise more. Our management currently focuses on wait times and patients have been accustomed to curbside delivery, promises by using an app, your order will be ready when you get there. And I don't know about you, but how many times has a pharmacist heard, hey, what's so hard about pouring pills in a bottle, buddy? I got to get out of here. you know, we don't work at Domino's Pizza, who promises fast pizza in cardboard box, and Domino's does not even promise good quality. So my answer is, do you want your prescription done fast or correctly? Do you want to receive a proper consultation for the use of the medication and how it impacts your health? And that a pharmacist is the only person that has that kind of training and experience that can do all these things. Thank you.
Thank you, Michael, for your comments.
And one quick last check. Seeing no additional requests, would you like me to close the panel?
Yes, please.
It is closed.
Thank you. Board members, I'm going to move on to agenda item number 6, but let me just ask, does anybody need a break?
Yes, I would like a 5-minute break at least.
Okay, well, let's see, I see it's 10:08. If we reconvene at 10:15, does that give everybody enough time?
Thank you.
Okay. Okay, let's take a break and we'll reconvene at 10:15.
Yes, I'm back.
Jason, you back? Very good, thank you. Song, are you here?
I'm here.
Perfect. Okay, I'm going to move on to agenda item 6, which is discussion consideration of board's legislative proposal to establish a new licensing program creating advanced practice pharmacy technician requirements and functions. So in the meeting materials, in response to changes in pharmacy practice and the expanded roles of pharmacists, the committee and board completed development of a statutory proposal to create a new licensing program for the advanced pharmacy technicians. The development of the proposal occurred over several meetings and evolved through the process. During the process of development, the committee and the board focused on proposed changes that would benefit consumers, including making pharmacists more available to engage in a direct patient care activities. As part of the January 2020 board meeting, members considered a recommendation from the licensing committee for its consideration. A brief summary of the basic tenets and the proposed language is included in the meeting materials. So at this point, I think the original plan was to kind of go through exactly what we had proposed in the past and around advanced practice technicians. And I think that is still probably the best way to kind of sort through advanced practice technician and see if we are still of the same mind as we were in the past. So I guess with that, let me just see, are there any thoughts from the other board members? So what I was going to do is just kind of go through the proposed section, then also go through the specified duties and conditions, as well as licensing requirements, renewals, and fees. So let me ask the other board members, are you in agreement that we should at least kind of, since with the advanced practice technician, we had brought this particular category, quite along the way, are you in agreement that we should kind of go back and review where this committee, the decisions that they've made in the past and kind of the thoughts prior, at the January 2020 meeting? Are you in agreement that's the way we should proceed? I'll start with Song.
Hi, Debbie. I'm not sure. Are you asking if we should go over the agenda item or are you? I'm not sure what you want to do. I just don't know if I want to talk about this. If we're going to have a summit, I really think that this could just be related to that summit. So I'm not sure what we would accomplish today if just talking about it, or
Yeah, I think it's because this committee, this particular idea, the committee had moved pretty far along. And so, once again, back in January 2020, we kind of had quite a bit drafted and quite a bit discussed. So I guess what I was thinking is we should at least go, if you look at the board materials, you'll see, there's a couple, it was kind of broken down into, a couple different sections and the recommendations that were made at that point. So I guess I was just wanting to go through those and see if we're still of the same mind, in agreement with both the committee of past as well as the board of past, or are you saying you want to scrap all the work that has been done and start new? I kind of hate to do that, but it's a committee.
well, I mean, I think so much has changed. So I'm still not fully agreeable to the idea of advanced pharmacy technician and the necessity of it. So that's my struggle. I mean, if I don't agree with creating a category of licensure, how can I talk about what is a requirement? So that's where I am. I understand that, we moved in the past, but things have changed. So that's why I mean, we can talk about it, but I'm just not there yet, and I need to know more. That's why I felt like this item should be tied to what we were discussing on agenda item number 4 and 5, so that we can kind of figure out, because this is a big issue. This is not something that we can take it lightly. I'm not aware of any other states that actually have this specific category of licensure, and please correct me if I'm wrong. And I mean, we are changing the scope of practice, and it's a big deal. So I just don't want to, I don't want us to get too worked up on this and then realize later we are wasting our time. So I mean, all the work that's done is great. I really think that is commendable. But I mean, I think we need to look at it as a little bit of a bigger scope from the bigger, outside of perspective on what we want to do and how we want to pursue. So that's where I am. I'm more than happy to discuss the issue, but I just don't want to. I don't have much to contribute today, just because I think I need more understanding of the bigger picture.
Yeah, I think, I mean, I understand where you're coming from because you did not live through the discussions and the building of this whole proposal, and all the work that has gone into it and all the, the comments and the effort and the board action was all, prior to your tenure here. And then to ask to your question, we're actually lagging to some extent in this, so we're not lead. California's not leading here. There's definitely other states that have this in play. They might not call it advanced practice or advanced technicians, but the scope of practice and what what we're discussing here absolutely has been put into play in other states. So. Okay, just kind of wanting to bring you up to speed since I know that you were not part of this in the past, and it is, I understand it is a big hill for you to climb. Cheryl, what are your thoughts?
Sorry, Debbie. One more thing. If there other states have done this, Debbie, I just want to know, because there's 50 states, we have 50 different pharmacy regulations, so it is very confusing. It's hard to compare apples to apples, and as Jason's comments, but if other states have done it, I would like to know what they've done it and what category they created and what most importantly, what were they allowed to do, and if there's any outcomes. That's what I want to know. So if again, if there's any research out there, information on those, I would love to see it. So that's where I am.
Yeah, I understand, Song, and that is what we've gone over in the past.
Okay.
But we can absolutely try to bring that information back forward for you to review. Because it was definitely not in the meeting materials, all the past minutes and all the documentation, everything we've gone through.
And I just wanted to say that yes, I was around for all of that and all that discussion. But I can say that this, like you say, January 2020, COVID, March 2020, and a lot of things have changed. A lot of things have definitely changed. And the way, as far as tech work is, and as a result, I personally don't even want to discuss it. I don't at this point. I have a feeling that it is something that that under the current situation, I can understand, even though we've put a lot of time into this. But when things change so drastic, what happened with COVID is just so drastic that I do feel that, yes, we did put a lot of work with certain feelings about the outcome. But at this point, I really think that this is something, I totally agree with Song on this issue. And as far as I'm concerned, we should not be we don't need to discuss it at all.
Okay, thanks, Cheryl. Jason, any thoughts?
Hi, Debbie. Beyond playing Sung's broken record again, no, nothing additional.
Okay. Moderator, I'm going to open it up to the public and get public comment.
Open the Q&A panel. If you'd like to make a comment on this item, please click on the Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Our first comment comes from Mark Johnston. Mark, you may unmute your microphone.
Thank you, Mark Johnson, CVS Health. I just want to say that I really appreciate the committee wanting to make an informed decision based on science as opposed to reacting to a few anecdotal stories. I will be able to deliver a wealth of information by the end of the day tomorrow. Thank you very much.
Our next comment comes from Lawrence. Lawrence, you may unmute your microphone.
Okay, once again, Lawrence Louis from United Pharmacists of Southern California. Similar to some of the other pharmacists, I too have worked at Walgreens and Target, subsequently CVS. So I am in complete support of the comments made by committees members O and Butler. I think we should table this item.
Thank you, Lawrence.
Our next comment comes from Rebecca. Rebecca, you may unmute your microphone. Rebecca, I've sent a request for you to unmute your microphone. If you click unmute me, we will be able to hear you.
Hi.
Rebecca?
Yes.
Hi, we can hear you.
Okay. Yes, my name is Rebecca Myung. I am a community pharmacist and have been a pharmacist in the outpatient setting for 14 years. I am in complete agreement with community members O and Butler also that this issue should be tabled.
Thank you, Rebecca.
Our next comment comes from Jazzy. Jazzy, you may unmute.
Good morning, Chair and board members. Jazzy Graywell with the FCW Western States Council. I would also like to echo Committee Member O and Butler's comments that we should table this item. And I'll go into a few points on why UFCW opposes the creation of an advanced pharmacy tech license. The creation of an advanced pharmacy tech license could worsen the earning potential for seasoned pharmacy technicians, as they may not have the financial resources or time to dedicate to training and licensing as younger, less obligated pharmacy technicians may. Effectively, an advanced pharmacy tech license requirement would create an income ceiling for existing pharmacy technicians instead of a pathway, and thereby enhancing inequities for workers. UFCW is particularly concerned that adopting an advanced pharmacy tech license would result in employment loss and wage stagnation for mid to late career pharmacy technicians. 71% of pharmacy technicians nationally are women. An advanced pharmacy tech license could result in damaging career opportunities for our California mothers. Additionally, an advanced pharmacy tech license expectation for existing pharmacy technicians would be an unfair addition to their terminal career licensing requirements, as they did not have the opportunity to calculate into their career training plan this advanced license type. An advanced practice pharmacy technician could result in seasoned California pharmacy workers earning less than less experienced workers who had the opportunity to calculate this license type into their career plans. Happy to answer any questions, as I know the chairwoman had a question previously.
It sounds like this is going to get tabled, so I'll just table my question. Thank you, though, for offering.
Our next comment comes from Michael Mattis. Michael, you may unmute your microphone.
Michael Mattis again. I'd like to have this tabled. It will divide the tech profession and implode that profession as well. And my biggest concern is you expand practice, advanced practice, whatever verbiage you want to use. Who's going to be responsible at the end of that complicated process of providing that prescription to a patient? And if you start dividing up who's responsible for what, that's going to be a huge mess too. You know, if you take a trip to Hawaii and you get on an airliner and you get there safely, the only person responsible for that flight is the captain. And that's the bottom line. And thank you.
Thank you.
Our next comment comes from Stephen Gray. Steve, you may unmute your microphone.
Well, thank you again for the opportunity. I agree that this should be deferred to the summit. And I'm not talking necessarily about the creation of a new license category under the statute, but there is information here about certain tasks that may be added to what a pharmacy technician can do. And I think that's where the discussion can go. But there's also information here that is very confusing about that is unrelated to the typical outpatient pharmacy. And we need to be very careful that we're not closing doors for some of the support that pharmacists receive in hospital pharmacies and in other settings from support personnel that are not licensed. I think that when you look at tasks and you want to add them to a license category, you have a responsibility to say, why does that particular task have to be done by a licensed person? As Mark Johnson said, show me the evidence. Show me the evidence that a person that does not have a license but has been doing that task for many pharmacists over the past 30, 40 years really now has to fall under some license category, or even as this proposes, even under a advanced practice license category. So I think this really needs to be deferred, not necessarily tabled. I would say referred to the summit for an overall discussion about the support personnel that are, and what tasks that they would have to do in a pharmacy situation and a pharmacist practice situation, which may or may not be in a pharmacy at all. Thank you.
Thanks, Steve.
Our next comment comes from Keith Yoshizuka. Keith, you may unmute your microphone.
California Society of Health System Pharmacists. While we strongly support the concept of the creation of an advanced pharmacy technician, I do agree that probably discussion on this topic should be deferred to the summit. Thank you.
Thanks, Keith.
And our next comment comes from Kathleen. Kathleen, you may unmute.
Yes, this is Kathleen again, community pharmacist in the outpatient setting for 32 years with independent pharmacy, Walgreens, and CVS. And I agree with those that have mentioned that this should be entirely tabled. Thank you.
Thank you.
And seeing no further requests, would you like me to close the panel?
Yes, please.
It is closed.
Okay, so I am going to take from the message from the other board members as well as pretty much everybody who spoke that we are going to table agenda item 6 and at this time I think I'm not sure if who was speaking, but let me finish my sentence and then whoever wants to speak, I'll open it up to the board members. I think what I was saying is let's go ahead and table agenda item 6. We can, I guess there's no need to go through this information at this point in time. I think what we need to discuss is in our summit that we're going to have, you know, what is the format of that summit? I hear clearly we want to talk about the pharmacy technician duties and possible changes, as well as technician ratio. And I think that might actually encompass, you know, if we feel as we address pharmacy technician duties and possible changes, I think that kind of incorporates if we're going to continue to support an advanced practice pharmacy technician, or if that's maybe some of those duties will just become, you know, part of the expanded, part of our consideration for the pharmacy technician duties. Let's go backwards. Jason, what are your thoughts?
Sorry, I had to unmute Debbie.
No problem.
You know, as far as designing the summit and what the interaction is, I think that I want a lot of outreach from stakeholders. I think even the idea of having it in person obviously would be most desirable. And I think it's also important to hear from the various stakeholders, and I think that there is a geographic component, north and south. So I don't know if it would be, I don't know if I'm opening up a can of worms by asking for, you know, more than one venue and date. I think that may be important, but I think that there's a lot of work to do on just designing it right now. But I would like certainly in person be preferable, lots of stakeholder outreach and input.
What do you think if the if I'm going to ask all 3 board members currently here, what do you think if the governor does not enable us to have an in-person, you know, in the next couple months, we don't hear anything? Is the summit something that you're willing to put off for an extended period of time waiting for in-person, or do you think it's more important to have the summit even if we have to do it virtual?
I think it has to be, I really think it has to be This is Song, Debbie. I'm
No,
sorry. I'm not-
actually, hey, Song, hang off. I was asking that question to Jason.
Oh, go ahead.
Oh, I'm sorry. I thought that was a to all board members.
No,
to
I was
delay it,
I was responding to your comment that if in person, if possible, and north and south. So my question to you is, you know, if it's, at some point it's going to be possible, but
Yes.
in your opinion, are you willing to wait? And I'm just going to throw this. I don't know how long it will be. I mean, it's a crapshoot. Are you willing to wait a year if we need to, or are you know, is this something you think we need to address? And so we need to move forward and hopefully hope that we can be in person.
I think that this is something that I would be okay waiting, and I think that, you know, quite honestly, I haven't seen the compelling reasons why this needs to be brought forward with such urgency right away. So I think holding off, I'd be okay, waiting until in-person meetings would be allowed.
Okay, thank you. All right, Cheryl, you're next.
Okay, Debbie, and I apologize for you weren't quite finished, and I was thinking it was time for me. It was okay for me to go on and recommend that we table the issue. I definitely did not want to be rude to you.
Oh, no problem. I didn't even know who it was, so no problem.
But anyway, I just wanted to motion that we, you know, table the discussion today. And that's what I was about to say.
So table agenda item number 6.
Correct.
Okay. Eileen, do we need to, I mean, it says a discussion and consideration, but I don't think we, do we need to vote that we're going to table it for now, or can we just move on and talk about the summit?
I think at this point, Debbie, we don't even have a motion approving the summit, so maybe what we need to do is find out if any of the board members want to make more specific motions, maybe addressing the summit and to table the, you know, the discussion, or is item 6 going to be within the summit? I think there are numerous ways we can go.
Okay. Cheryl, so with that,
Debbie?
do you want to make a motion?
Debbie?
Yes, Ann.
Debbie, this is Ann. I apologize for interrupting.
No problem.
Because the board does have an active proposal, if the committee wants to table the advanced practice, that might be something that they want to offer as a recommendation to the board, just because you do have a, you know, a proposal in play.
Okay, so Cheryl, is that what your motion is, to table the current proposal to establish a new licensing program?
Yes.
Song.
Okay. All right. I'm going to go back to Jason, since we have a. I'm going to work through the motion first, and then we'll go back to the summit idea. So, Jason, do you have any comments on Cheryl's motion that Song second about tabling the current legislative proposal? You know, that we were getting ready to discuss, but we've kind of, you know, but the motion is to table it. Do you have any comments that you want to make about that?
No, I can vote.
Okay. Song, do you have any additional comments you want to make?
Not at this point. I just think that you know, we in general, just general comment. I think we should look at really um how we go forward is, every pharmacy technician is different, and this is why it's a challenge and it's a struggle and it's difficult. And I think we need to figure out how we can be more agile as well going forward, so that a certain technician who may be excelling at certain things can do more. So that's just my comment, and hopefully we can figure it out moving forward.
Okay, that's your comment around tabling the proposal. Okay. Okay, moderator, can you please open the
Debbie,
phone
hi,
lines?
this is Debbie. Hi, this is Eileen. I just wanted to suggest, if you don't want to open it up for public comment 2 times, if there's going to be a second motion with respect to the summit, maybe you have that at the same time. But that's up to the committee.
If that's
Yeah,
okay.
I think we do one at a time. I think let's just, you know, get comments on if there are. I mean, I'm not sure there's going to be a lot of comments because I think that's what people already have told us. So right now I'm just taking comments solely on the motion to table the proposal to establish a new licensing program.
Open the Q&A panel. If you'd like to provide any additional comments on this item, please click on the Q&A icon on your screen. Type "I would like to type comment" into the text field and submit that to the panelists. And seeing no requests, would you like me to close the panel?
Yes, please. Okay, thank you, moderator. Since we have a motion to table the proposal to establish a new licensing program, creating advanced practice pharmacy technician requirements and function, and it's been a motion by Cheryl, seconded by Song. We've had an opportunity for the public to comment, of which we had no comment. I'm going to go ahead and do the roll call. Jason.
Just to be clear, does this mean that this issue would not be addressed in a summit, or would we move forward with it in discussion?
So the board had a legislative proposal to establish a new advanced practice pharmacy technician license type that was worked on in the past, and so we were going to be working on fine tuning that proposal. And so what we're doing now is we're saying no, we're going to table that proposal and basically start anew. I think with this, we'll start anew with the summit. I think is the direction we're heading.
Okay, I think it'd be best if I abstain, Debbie.
Okay. Cheryl. Song.
Yes.
And I'm going to vote no, just because we put so much time into the proposal. But the motion carries. All right, so now Cheryl, I'm back to you to ask you about your thoughts around the summit.
Actually, I feel good about the whole the idea of the summit, and I do agree with Jason in that I'm good with whenever we can have it, we can all get together. I actually heard Song make a statement at the beginning when we first started talking about our discussions today, that once we arrived at this point that he would like to make a comment about the summit that would take in everything, and I'm okay with whatever he had to say.
Okay, and I guess specifically, so the summit, you would like for it to be in person?
Yes.
And you would like for, it's more important, so once again, I'm just trying to wrestle with timing. We don't know when we'll be able to have it in person. Are you saying that you would be okay waiting to address these issues until we can be in person? Or do we kind of have to massage that?
No, I totally agree with Jason's position on this and the importance of it.
Okay. Okay, thank you. All right, Song, what are your thoughts on the summit?
So do we need a motion probably to create a summit? So I'll make a motion to create a summit discussing, in-person summit discussing and consideration of pharmacy technician duties and possible changes, as well as pharmacy technician ratio in community and sterile compound settings, and delegate the authority to the president and the executive officer in terms of scheduling and membership of the committee, or will it, so this and that.
No, it would, the summit would be a summit of this committee. So
Okay.
it's this committee that's recommending the summit.
Okay, if that's the case, we'll do the, so we'll have like a summit of whole day. I guess we'll have a licensing committee whole day just for this issue, correct? That's the
Correct.
Okay. Then that'll just be my motion, is to create a summit discussing and considering pharmacy technician duties and possible changes, as well as pharmacy technician ratio in community and sterile compound settings.
And you said in person when you first made your motion. So I just want to point out you want that part of your motion, right?
Yes.
Okay.
I would second.
Okay.
I would second that, Debbie, but I'm trying to. I'm second. My second is on the summit, but I don't necessarily feel that our meeting has to be in person. I'm thinking the summit is what we're talking about as far as being in person, correct?
Right. The summit is a meeting of the licensing committee is going to host the summit. And it's going to be not really a licensing committee meeting. We're not going to have other like agenda type items. Our focus will just be per Song's motion. It would be discussion and consideration of pharmacy technician duties and changes, as well as ratio both in the community and the sterile compounding pharmacy settings. One thing, Song, I'm just going to throw out there. Do you want to limit the ratio discussion just to those two settings, or do we want to just have a ratio discussion? And it's just simply a question to you. You made the motion, so however you want to handle it.
Well, I do think that we should discuss in all settings, but I'm neutral on that. On that discussion. So let's just do, so that we have some flexibility, we can just do ratio in general.
Okay. Yeah, because we're kind of doing pharmacy technician duties. That's in general too. So, so I think that might be wise. All right, and Cheryl. So with that change, are you okay with that change?
Yes, I am. Thank you.
Okay. And did I answer your question as far as the summit? Okay. So yeah, if we have a future licensing committee meeting, it could potentially be, if we can't get in person, it could potentially be virtual again. But the summit, per the motion, we will be waiting until that point where we can do it in person.
Thank you.
Chair Veal, hi, this is Eileen. I just want to check too, and it's just for clarification to President O's motion. So your motion would exclude discussion of the advanced practice pharmacy technician, and I just want to see if it still includes a delegation to, you had said, the president and the executive officer to start to establish the criteria and possibly the agenda for this summit.
Yeah, I would like to, I think what we should do is to discuss advanced practice technician included into the additional duties of technician.
Yeah,
So
I agree.
so that's where I want to go, and also um, the delegating to the president and executive officer. I think it would be okay to delegate to the chair of the licensing committee. So whichever it's more practical, since it's going to be under licensing committee. I thought where we were going was creating a whole summit under a new kind of committee. But if it's under a licensing committee, um, I would be okay just delegating to the chair and the executive officer.
Thank you. I was just trying to get that clarification.
Yeah, and Ms. Smiley, I think as I mentioned earlier, you know, when we look at the pharmacy technician duties and possible changes, we may or may not come back to advanced practice. So I agree with Song that we don't need to call that out specifically.
Oh, okay, that's fine. I was just checking because as we develop agenda items, I just like to make sure they're broad enough to encompass what the board wants to accomplish, or the committee in this case.
So if we do definition, consideration of pharmacy technician duties, it could evolve into advanced practice, but it doesn't have to. In the summit. All right, any other comments by board members? And if any other comments by board members, let me just stop there. Okay, moderator, will you please open the phone lines?
We've opened the Q&A panel. If you have a comment to make regarding the development of this summit, please click on the Q&A icon on your screen. Type I would like to make, actually, no. It's going to take me a minute to get used to this. Type just simply comment into the text field and submit that to all panelists. We do have one request from Kathleen. Kathleen, you may unmute your microphone.
Yes, I appreciate a summit being suggested for this topic, and respectfully ask that it be in more than one location so that, as said before, both ends of the state can contribute, participate. Thank you.
You know, Kathleen, just a comment. Whenever we have, we'll make sure, you know, we'll have to talk about the logistics of multiple meetings, but if we end up with just one, please know that even if we're in public, in person, that we will make sure that it's webcasted and that people can call in. But, you know, if we can try to have more than one location. The executive officer, we're going to have to work with her to see if that's an option.
Our next comment comes from Lawrence. Lawrence, you may unmute your microphone.
Yes, in full support of an in-person summit, and to reflect committee member White's comments to involve as many stakeholders as possible, which may include multiple locations. So thank you.
And our next comment comes from Stephen Gray. Steve, you may unmute your microphone.
I completely support the going forward with the summit and to when it can be in person. It's very important. And to show you how important this was, I might be the only one old enough to remember, but when Abe Grunstein was the president of the Board of Pharmacy back in the 1993, I believe, which was the time period after OBRA 90 in which we created in California for the first time the license category of pharmacy technician. It was such an important issue to share and discuss all of the ramifications and to get support for, that the Board of Pharmacy not only had multiple locations for its discussions, but it actually scheduled those discussions and meetings after hours. I remember attending one in downtown San Francisco that started at 7 p.m. in the evening so that pharmacists and other personnel would have the opportunity to participate. And I believe there was also one in downtown Los Angeles that was scheduled after hours also. So I just would hope that because this is so important to going forward on many aspects, that the board would consider the extraordinary possibilities of how to do the outreach that board member Jason thought was so important, and I agree with that. It is true we have the ability to do remote participation, but as we all have just discussed, remote participation is not as good, is not the same as in-person participation. Thank you very much.
Steve, thank you for that comment, especially the after hours comment. I think that's very pertinent.
I'd like to say I just love the word that he said, because I loved Abe Grunstein. Thank you.
Any changes to the motion to make sure that that is possible, or can we make that logistical challenge determination with you and
I believe that the notes reflect it. Eileen, what are your thoughts?
And by that, you mean the after hours?
Yes, Eileen, after hours.
Probably after hours and probably even multiple locations. Do we need to add that to the motion?
I think the most important thing is outreach, and maybe what we may have to do a motion, an amendment to the motion, but I don't know if there's any other public commenters on this point before we get to that. Moderator?
Request for comment. Actually,
all right, then
one more just clicked in.
Okay. Why don't we take that up, President O and Chair Veal, after we hear the last public comment on this issue?
Okay.
Okay, and our final comment at this point in time comes from Michael Mattis. Michael, you may unmute your microphone.
Hi, good morning again. I'm in favor of multiple public meetings so we can participate and so I can participate, and I'm happy to do that. Thank you.
Thank you, Michael.
And with that, I see no further requests.
Thank you, moderator. Will you please close the Q&A?
It is closed.
Okay, back to you, Eileen. So what's your recommendation on the amended motion?
I think the motion that we modified before public comment is broad enough to encompass, it's delegating to the executive officer and the chair of this committee, working out the logistics of the summit. And so nothing's set in stone, and the executive officer and the chair would have the flexibility with which how to engage outreach and also to work on the logistics of that meeting when an in-person meeting is available.
And I think the important thing that we heard was more than one meeting.
And I think that goes into the logistics, Chair Veal.
Okay. All right, are you okay with that, Song and Cheryl?
Thank you.
Okay, I think the minutes adequately reflect the feel of the board members as well as the public. All right, since we have a motion seconded, public comment has been received. Let's go ahead and call for the vote. Song?
Yes.
Cheryl?
Yes.
Jason?
Yes.
And I'll vote yes, so it passes unanimously. Okay. Moving on to agenda item 7, discussion consideration of the committee's strategic plan goals. In the board packet were the goals, the current committee goals, and I'm sure everyone had a chance to review it. And we also know that in the near future, the board will be developing a new strategic plan. One of the areas I wasn't sure if we wanted just to chat about is the evaluation of various types of pharmacies and determine if our law adequately regulates the different settings. And specifically, this is call centers, mail order pharmacies, some of those settings that maybe are a little bit, well, I don't want to call them newer because they've been around, but I think, have been starting to bubble up more. I don't know if there's any thoughts from the members about how we might want to address, or if we want to, make that perhaps a new goal that we could take to the strategic planning meeting that we'll be having at some point in the near future. Song, do you want to comment on that?
Hi, Debbie. Thank you. Yeah, I think we need to discuss how to make our pharmacy licenses a little bit more specific, just because the scope and the details are so different since we only have pharmacy category. And I don't know how logistically we would do this, other than just maybe discussing this at the strategic planning session, upcoming strategic planning session.
Yeah, I think what we would do as part of we'd make it one of the goals that our committee would recommend. And so then during the session, we could kind of sort it out, figure out if it comes back to this committee to decide, or, exactly, how, and you'd probably be involved in that decision, exactly how it's parsed out. But I think more it's just that we go to the strategic planning with the idea that maybe this is something that needs to be addressed.
I do think that this needs to be addressed for sure.
Okay. And we don't, do we need to make a motion, or is it just as far as moving it forward to the strategic planning meeting?
Wants to offer the recommendation to the board, it's probably best through a motion, but I believe you could make the recommendation even without it. The motion from the committee or the recommendation from the committee would otherwise serve as the motion during the strategic planning session.
Okay. Cheryl, let me finish going through everybody. Cheryl, do you have any thoughts?
I would just say I'm in agreement with both you and Song on this issue. So I'm okay with it, whether we need to make a motion or, whatever we need to do to have it be a discussion or something that we actually handle, be it in the strategic goals, but I definitely think this is an issue that we should be addressing.
Okay, thank you. Jason, do you have any comments you'd like to make?
I'm in agreement also. Happy to make the motion if we need one.
Why don't you make one? I think, just to kind of memorializes it. And
okay, happy to make the motion. I don't know if Ann or Eileen help me out on the language here.
I think maybe something along the lines of recommending to the board inclusion in its next strategic plan to incorporate an evaluation of the various pharmacy practice settings and determination if changes in the law to reflect the variances in the practice settings are appropriate.
And that will be my motion. Thank you.
And I would second motion.
Thank you, Cheryl. Moderator, can we open up the lines for public comment?
Allow me just a moment. Going to go ahead and open the lines and reload the PowerPoint. Do not want to be working on it. Let those come in.
There we go.
That looks better.
Yeah.
I love when we test the new WebEx. You were our first meeting in the new environment today, so congratulations, y'all are doing well. Our first comment comes from Stephen Gray. Steve, you can unmute your microphone when you're ready.
Thank you. I would also suggest that this be a part of the discussion at a strategic planning meeting, but I would caution the board members as they begin to think about this to also get information from other boards of pharmacy that have gone down the path of trying to license all the settings in which a pharmacist may in fact practice. California has this board of pharmacy and the profession discussed this many times long ago, and we have a definition in the law that says that a pharmacy by definition is a place where pharmacy is practiced and drugs are prescription drugs are contained and dispensed or compounded. And it also, the law says that a pharmacist can practice in their profession in any setting, and it does not have to be in a licensed pharmacy. Some states have gone down the path, and I believe Texas, for an example, at one time, it maybe still does, has categories A through K of licensed locations that they call pharmacies. And it has completely complicated and inhibited the practice of pharmacy. You know, the board has, there is a bill, as we all know, AB 1533, which is moving, hopefully, the practice of pharmacy to the standard of care process, much like physicians' practice is. And physician offices are not licensed. They are wherever the physician happens to practice is theoretically his or her office. So I would really caution the board going down that path, or if to do so, they should go down it very carefully, very deliberately, and learn what other states have learned, and also think about where this is taking the practice of as a pharmacist versus a pharmacy. One state has already completely separated the regulation of a pharmacy from the regulation of a pharmacist. Thank you.
And I think as a strategic, I mean, even coming out of the strategic planning meeting, it's still more of a, a goal, something we can evaluate. We're not definitively going to do anything, but I think those comments are, are well received. I mean, I think those are valuable comments.
And seeing no additional requests for comment, would you like me to close the panel?
Yes, please.
It is closed.
Okay, board members, so we have a motion, a second. We received public comment on the motion. Let's go ahead and vote. Jason?
Yes.
Cheryl? Song?
Yes.
And I'll vote yes. All right, moving on to agenda item 8, which is review and discussion of licensing statistics. This is the last item of our review, is the licensing statistics, and the data was provided in the meeting material, which represented information through June 25th. Meeting materials indicate that the board has received 14,244 initial applications, and also 542 requests for temporary site applications. During this time up to June 25th, the board issued 7,777 individual licenses, 427 temporary licenses, and 489 permanent site licenses. Processing times are also included in the meeting materials, and based on my review, it appears processing times for applications, unfortunately, are outside the board's performance measure. In part, these delays are caused by vacancies and unexpected leave of absences for the staff. We are hopeful the staff returns from leave and vacancies are filled, so the committee can see improvement at our next committee meeting on meeting these timelines. In addition, in the annual statistics is a 3-year comparison. Based on my review, it appears that the general workflow is trending down. Members, I don't know if there's any additional comments you want to make about any of the reports provided in the materials.
Hi, Debbie. I just have one question about under applications received, under intern pharmacists and pharmacist exam applications. It seems like they're going down quite a bit. I'm just curious if there's any underlying reason, or is this because it's not fully reported for the fiscal year 2021?
Anne, can I ask you to provide your thoughts on that question?
Yeah, I'm happy to. So I think some of it is probably a function of not having the full fiscal year because of school enrollment times and applications specific to the interns. I do also believe that although there are additional schools of pharmacy, I have heard anecdotally that maybe not all schools are able to fill all of their slots.
Okay, thank you, Anne. Thank you for your explanation.
Cheryl or Jason, remind me to do this one at a time so you don't have to talk over each other. Cheryl, do you have any comments or questions?
No, I'm good. Thank you, Debbie.
Jason, do you have any comments or questions?
Debbie.
Okay. Any public comment? Moderator, could you please open the phone lines to see if we have any public comment? Well, we're not hearing you, moderator. I'm sure you're seeing that the lines are open.
Oh, yes, it would help if I would unmute myself, wouldn't it? Our Q&A panel is open. If you'd like to make a comment on this item, please click on that Q&A icon on your screen, type comment into the text field, and submit that to all panelists. Not seeing any requests, would you like me to close the panel?
Yes, please.
It's closed.
Thank you very much. All right, we are at the end of our committee meeting. The next formal licensing committee meeting will be October 27th, 2021. And at some point in the future, we will also announce dates and times and locations for our summit meeting. But as directed, I think we have to wait until we have the opening from the governor that we can do it in person. So with that, I would like to thank everybody for your time, and the meeting is adjourned.
Everybody.